In a life or death situation, it's the one place where Australians count on getting urgent care. But the nation's hospital emergency departments are buckling under the strain.
We have patients who are having worse health outcomes because of their hospital access delays, and in a lot of cases, that means they're dying.
You're being taken to hospital for the medical help you need. You expect to be taken into hospital, not to sit in an ambulance.
Yvonne James believes delays at Adelaide's Flinders Medical Centre may have hastened her 88-year-old mother's death. Edna Labram was rushed to hospital in late 2018 after a fall at home, but was forced to wait in the back of an ambulance.
She got there by about 10:30 and the whole ambulance bay at Flinders was full. It was quite daunting to be sitting there thinking there's people in all these ambulances that can't get in.
The controversial practice is known as ramping, when paramedics continue to look after a patient, either in the back of an ambulance or in a hospital corridor when the emergency department is full. After an hour and a half in the ambulance, Edna told paramedics she needed to go to the toilet.
The ambulance officer said no, she couldn't go into the hospital. They had to get permission and hadn't got that permission to go in. And Mum said, but I really need to go and I can't hang on any longer. And she was getting quite anxious, quite distressed, and she did soil herself.
Once she was admitted to the emergency department, it took hours to see a doctor.
He just looked at her and said, oh, okay, well, is Panadol all right, or would you like some Endone? And she said, well, what do you think's going to help me? And he said, oh, well, what would you rather have? And Mum went, well, I'll just have some Panadol, that will be fine. So he went off and never to be seen again.
Yvonne's mum had leukaemia. While in hospital, her condition deteriorated. She died days later in intensive care.
I think the ramping and the experience that we had with the ramping, what I deem was lack of care for those first sort of 6 hours in ED, that did shorten her life.
Is Yvonne James owed an apology?
Yeah, I apologise to Yvonne for the fact that her mother was delayed on the ramp at the hospital. I can assure her that we're doing everything we can to ease ambulance ramping.
Health unions blame ramping for 3 other patient deaths in South Australia over the past 12 months. Other states are also feeling the strain.
I think the highest I've heard is one patient being ramped for 18 hours. I have crews who spend their entire 14-hour shift ramped. I've had a lady who had a heart attack have her entire duration of care managed while she was sitting on an ambulance stretcher.
Lauren Heifer is a paramedic and union delegate in Tasmania. She says emergency department overcrowding is prompting record levels of ramping there.
It means that we can't respond to people within the community. It means that you're waiting as the consumer for an ambulance to be free to come out to you, and that might cost you your life.
The Tasmanian Health Minister was unavailable for interview, but said the state had hired hundreds more staff and planned to open 250 beds over the next 6 years to help meet demand.
As ED nurses, it's incredibly frustrating. It's incredibly distressing to not be able to care for patients the way that we want to care for them.
The nation's emergency departments are under increasing pressure because of a sharp rise in admissions over the past decade.
Just going to check your observations and make sure.
Mental health presentations have soared, up about 70% over the past 15 years.
Just going to check your temperature now.
So I have a history of PTSD, which is from childhood trauma, from child abuse, and I've also got a dissociative disorder, which is again a result of being abused as a child. After hours and on weekends and things, there isn't other options to get help and support. There's nothing but the ED.
Mental health patients like Brooke Bickley are getting stuck in emergency departments because of an overstretched community mental health system and a shortage of acute care beds.
You're often put in, a recliner in a busy walkway where you've got people coming and going, walking past you. You've got ambulances coming and going. You've got, it's busy. There's lights everywhere. There's machines beeping. It's quite a chaotic environment.
Well, South Australia is involved in a whole range of nation-leading initiatives. One of those is to have a mental health clinician in the ambulance with a paramedic as they respond to a mental health patient. The results from the recent pilot have suggested that 50% of patients who would otherwise come to the emergency department can receive care in the community.
In Western Australia, figures released by the Australian Medical Association show 180 mental health patients were stuck in an emergency department for more than 24 hours last month, a 64% rise on December 2017.
Many patients spend days being sedated, restrained. The fact that we keep patients for 24, 48, sometimes 4, 5, 6 days in those environments is extraordinary. It's actually torture.
The Western Australian government says it plans to open 50 new mental health acute care beds and has contracted more than 100 GP clinics to treat general patients who would likely have ended up in emergency departments.
Just wrap this around your left hand here.
South Australia has a similar initiative.
In the second half of last year, we opened 4 priority care centres across metropolitan Adelaide. They've seen more than 1,500 South Australians who would otherwise have needed to go onto the emergency departments.
For Yvonne James, the memories of her mum in the back of an ambulance and in the emergency department will always haunt her.
Something needs to be done. I don't know what the answer is, but something has to be done so that other families don't have to suffer and patients don't have to suffer and suffer some of the indignities, like my mum.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.